بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وآله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك أنت العليم الحكيم. My topic today is about continuation of the ultrasound of the kidney in adult patient, and here we see some of the pathologic condition. As we said before, the common pathology on the involving the kidney, and by ultrasound we can see calculi or stones, we can see renal cyst, we can see tumors, can be benign, can be malignant, as in angiomyolipoma or renal cell carcinoma. We can see hydronephrosis, and we can see medullary sponge kidney and polycystic kidney disease. I will show you some of the examples of these conditions and some of the pitfalls. Before the pathology, we should know the normal variants, and we see here this is the splenic hump, and should not be mistaken with the renal mass, and also it is called pseudomedullary hump. Here we see duplication of the renal system, and you see here it is the duplication and duplication of the system, and here we see the normal variant of fetal lobulation. Here we see columnobertin hypertrophied or prominent columnobertin, and it is also a normal variant. Horseshoe kidney is the horseshoe kidney, the long axis of the kidney. It is parallel to the spine, and it is fused in the lower ball. Sometimes it is difficult to see the fusion in the lower ball because of uh, interference with gas. And this horseshoe kidney, it has an increased incidence of infection and calculi and the tumor. And as you see here, this is the right kidney and this is the left kidney, and it is fused in the midline and this is the aorta. And this is the smooth fusion. It is anterior to the aorta, as we see in this ultrasound image. And this is the sagittal view of the smooth of the horseshoe kidney. Here you see that this is a patient with nephrocalcinosis, and you see multiple echogenic area involving the biomids and the medulla. Here is another patient with multiple renal stones, and you see the stones here in the mid-lower caudicary group associated with shadowing, and that shadowing, it is shadowing, but there is no hydronephrotic changes. And this is another stone in the lower calyx also. Here, this is a small stone with shadowing, as you see here, but with no hydronephrosis. Hydronephrosis, degree of hydronephrosis or range of hydronephrosis, this is a normal, and these are the pelvic system. This is mild hydronephrosis, and you see this is the moderate hydronephrosis. Between the mild and moderate hydronephrosis, there is no calyceal dilatation. Here there is some calyceal dilatation, and here there is, in the severe cases, there is the calyceal dilatation associated with cortical loss. In the moderate hydronephrosis, there is no cortical loss noted. It is the same here. This is the mild hydronephrosis with dilatation of the pelvic calyceal system, and here there is moderate and severe associated with cortical loss. Here there is a mild hydronephrosis, only you see the distension of the pelvic calcaneus system, good cortex, also normal, you see in the normal variant fetal lobulation. Here it is moderate, hydronephrosis, you see dilatation of renal pelvis and dilatation of the calcaneus system, and there is no significant cortical loss. Here, this is a stone in the renal pelvis or pelvic ureteric junction causing hydronephrosis, and that hydronephrosis mild to moderate hydronephrosis, and you see good renal cortex. Uh, Here you see hypoacutic mass lesion in the lower ball of the kidney, and you see this is acoustic enhancement indicating that the mass is a cyst. This is another patient with multiple renal cyst and patient with cystic renal disease, autosomal dominant renal disease. You see multiple variable size cyst bilaterally. Here you see a tumor mass in the kidney and you see a hyperacute mass with no increase in the vascularity involving the upper mid-ball kidney in keeping with angiomyolipoma. Here you see another patient with large mass involving the lower ball of the kidney. It is hypomicrogenicity consistent with solid renal tumor, renal cell carcinoma. Here you see echogenic of the kidney in patient with renal failure. You see loss of differentiation between the cortex and the medulla, and the renal sinus echoes is about equal to the cortical echo, and it is more than the liver. Another patient with a chronic renal failure, you see echogenic kidney with loss of differentiation between cortex and medulla, and you see some cyst here. Another patient with a chronic parenchymal renal disease with multiple cysts and increase in the renal echogenicity. This is important. Beers and pitfalls. Renal cysts sometimes can be mistaken with hydronephrosis. Cysts are typically single and arise in the periphery of the kidney, but if it is multiple seen in the polycystic renal disease, collecting system located outside the renal pelvis, it is termed as extrarenal pelvis, and it is mimic sometimes the hydronephrosis, and it is a normal variant. Overhydrated patient uh, may have mild hydronephrosis without obstruction. Underhydrated patients, sometimes in early stages of scanning, we cannot see the hydronephrotic changes in obstructed patient with renal colic. Mild hydronephrosis may be seen in a pregnant patient uh, or, or with one full bladder. It is a normal variant. In some cases, such as a fluid-filled gallbladder, sometimes can be mistaken with a renal cyst. Remember, the patient with multiple renal cysts also have liver cyst, and you should see that liver cyst and look for it. And certain forms of polycystic renal disease is associated with aneurysm and intracerebral aneurysm. We should look for that. Be sure that aorta for aortic abdominal aneurysm in patient who clinically appears to have acute renal colic, but in whom the renal scan is normal. And thank you very much for listening. Hoping it will help you in daily practice.